Roosevelt Urgent Care. We have a quick presentation tonight. We're actually presenting the hands-only CPR committee here with a child mannequin, an infant mannequin, to continue the services that they're providing to this community. It's something that we're very interested in. We provide in all of our facilities, and with God's help, we're going to start working together. We provide CMEs, like just different medical educational classes, to the community free of cost, because it's something that we feel is very important. CPR is one of the biggest courses that we give, because it's really essential. It's very, very important. Studies show that early CPR, before obviously healthcare providers and the hospital employees that are able to work on a patient, early CPR is really, assuming you get the patient back, what is going to keep that person going healthy. It's going to actually keep the brain healthy, because it's keeping the oxygenated blood running through the body, which makes sure that all the living organs and essential body parts work properly. So it's extremely important. On the island for sure, this is something that we are very interested in helping out, because again, you can call 911 here, and we discussed, we have a committee that meets in our offices to discuss how to better our services for the community, but we definitely discussed that emergency response here is sometimes lacking at times. So this is just another way what we feel is something very important that we can teach the community, so that something, for instance, if God forbid there's an instance where CPR needs to be performed, that many people on the island will know how to do this. And we feel that that's very important, and this is something that we wanted to give back to the community. In addition to the other services that we will provide, this is something that we feel is very important. So without further ado, I'd like to present Sharon Williams with the CPR infant mannequin. All right. We hope to be able to work with the community, and we are definitely, our goal is that the community should know that we are here for you, for them. And again, we are now working with Dr. Resnick and Dr. Grimm in our facility, and we essentially are the only medical facility on the island. And again, we would like to hear from anybody if anybody has concerns or questions or comments. And we just want everybody to know that we really are here for you, just as a token of appreciation almost. But like, we came before we opened the facility here. I had never been to Roosevelt Island. I had seen it every time I crossed over the bridge, but I had never really been here. And I'm actually moving my office here the next week or two, because it's just a really beautiful place to be. Really, really is. I couldn't be more thrilled. I mean, again, like I said, I've been in the city, I grew up in the suburbs, I've been around, I've never been here. When I came here, it was like a breath of fresh air. It's a beautiful, beautiful island. You guys should be proud, and we're really happy to be here. I'm happy that I get to partake in this now. So thank you very much for welcoming us in. And if anybody needs anything, my number and email address can also be shared with everybody. And thank you very much.
I just wanted to say a huge thank you to Jack and to the Urgent Care Center for really taking a huge interest in our community and wanting to provide education and supporting our efforts to train islanders in hands-only CPR and infant CPR, which is not hands-only, but this is a huge help, and we're so thrilled that our committee can now provide infant training. For so long, we could only provide adult training, but now we are equipped to train infants, which has been a huge demand from our community, and we just appreciate the Urgent Care and Jack's support and partnership with us, and we just look forward to going forward together.
Thank you very much.
And by the way, we trained 1,063 people today. And it takes 5 minutes to learn, and I'm all set up across the hall. You can come in after the meeting tonight. Just get trained real quick, and you'll be ready to save a life. So thank you.
Thank you very much. Thank you.